Let's talk about the Zhang organs, the liver. The liver is related to the tendons and body constituent and shines in the nail. The tendons, also known as the sinew membranes, include the tendons and ligaments. They connect joints and control movement. This kind of movement depends on the nourishment of blood. Sufficient liver blood can make the human body endure hard work and recover quickly from exhaustion. If there is a disorder in liver, it can lead to various tendon diseases. If the liver blood is deficient, tendons cannot be nourished, which can result in trembling of hands and feet, numbness of limbs, influence of joint movement, and the nail, including hand and foot nails, is an extension of the tendon. Therefore, there is a saying, nail is an extension of tendon. Luster of the nail depends on the nourishment of liver blood. Sufficient liver blood ensures dense nail with luster, while insufficient liver blood would cause thin, frail, or even deformed nail without luster due to malnutrition. So the luster of nail can reflect the function of the liver. The physiological or pathological functions of the liver can be judged by the nail in clinical settings. The function of eyes is based on the free coursing of liver qi and nourishment of liver blood. The function of the liver is always manifested from the eyes and its function. If yin or blood of the liver is deficient, there would be dry eyes, blurred vision, and night blindness. Wind heat in the liver meridian can lead to red eyes with pain and itching. Liver fire flaming upward can lead to red, sore, and swollen eyes. Ascending hyperactivity of liver yang can lead to dizziness and vertigo, and liver wind can lead to upward staring of the eyes. Because the liver is closely related to the eyes, the function of the eyes can reflect the function of the liver. Doctors often treat eye disease from the liver meridian. Anger is the reaction of the body to the outside information. Ancient Chinese believed that anger was a normal emotion. It is a normal reaction to be angry when something bad happens. It helps the liver to disperse, smooth, and regulate. However, sudden anger or constantly being in a bad mood is easily to damage liver. Therefore, there is a saying in Suen Yin Yang Yin Shang Dalun, which means rage injures the liver. The tears come from the eyes, so they are the fluids of the liver. Tears moisten and safeguard the eyes. Wind heat in the liver meridian or deficiency of the liver and kidney can lead to epiphora. The deficiency of liver blood or yin deficiency of the liver and kidney can lead to dry eyes. Thank you for your attention.
Let's proceed to interviewing and continue our discussion on tinnitus patterns. In kidney deficiency, there is tinnitus and or deafness with gradual onset, and tinnitus is characterized with low rushing sound, and there is also dizziness, backache, and tiredness. Other symptoms and signs, including those of the tongue and pulse, depend on whether there is kidney yin or kidney yang deficiency. For acupuncture, we can use REN4, kidney 3, and bladder 23. In liver yang rising, there is tinnitus and or deafness. Tinnitus being with high-pitched sound, accompanied by headaches, dizziness, irritability, a propensity to outbursts of anger, and a red face. And the pulse is wiry. For acupuncture, we can use liver 3, gallbladder 20, triple burner 5, gallbladder 43, triple burner 17, and gallbladder 2. In liver fire, there is tinnitus and or deafness with sudden onset, tinnitus being with high-pitched sound and accompanied by red face, bloodshot eyes, headaches, dizziness, irritability, propensity to outbursts of anger, thirst, bitter taste, constipation, dark urine, a red tongue with redder sides, and yellow coating, dry yellow coating, and the pulse is wiry rapid. In phlegm fire affecting the liver channel, there is tinnitus and or deafness with sudden onset. Tinnitus characterized with high-pitched sound. There is thirst, a bitter taste, a red face, feeling of oppression in the chest, sputum in the throat, catarrh, red tongue with redder sides, swollen with a sticky yellow coating, and the pulse is wiry, slippery, rapid. In heart and kidney yin deficiency, there is tinnitus and or deafness with gradual onset. Tinnitus characterized with low-pitched sound. There is dizziness, insomnia, anxiety, palpitations, night sweating, tongue without coating, and a floating empty pulse. In heart blood deficiency, there's tinnitus and or deafness with gradual onset, tinnitus characterized with low-pitched sound. There is also dizziness, poor memory, palpitation, insomnia, anxiety, dull, pale complexion, a pale tongue, and a choppy or fine pulse. In heart and lung qi deficiency, indicating a deficiency of gathering qi, there is tinnitus and or deafness with gradual onset, tinnitus characterized with a low-pitched sound, accompanied by tiredness, palpitations, depression, shortness of breath, a pale tongue, and a pulse weak on both front positions. In liver blood deficiency, there is tinnitus and or deafness with gradual onset, tinnitus being characterized with low-pitched sound. There is dizziness, a blurred vision, insomnia, poor memory, a pale tongue, and a choppy or fine pulse. In invasion of wind heat in the lesser yang channels, there is sudden tinnitus and or deafness, tinnitus characterized with a high-pitched sound, accompanied by headache, stiff neck, sore throat, burning eyes, slight sweating, fever, aversion to cold. The tongue is red on the front side and a floating rapid pulse. A clinical note, by experience, tinnitus from a deficiency is easier to treat than one from a fullness. Thank you for your attention.
Diagnosis according to 8 extraordinary vessels. Dai Mai, Yin Chao Mai, Yang Chao Mai imbalances. Dai Mai imbalances. The signs and symptoms are aches, pains, weaknesses, or problems along the path of the vessel, especially pain in the hip and waist region. There's abdominal bloating, a sensation of sitting in a tub of cold water, vaginal discharge, irritability, lumbar, weakness, uterine prolapse, miscarriages, infertility, burning and difficult urination, cold feet, weakness in muscle, atrophy in the legs, dragging, heavy menstrual pain, cold or moist genitals, heaviness and fatigue of the whole body, wiry pulse on both guan positions that vibrates from side to side. Acupuncture treatment would be Gallbladder 41, Sanjiao 5, local, distal, and tender points along the course of the daimai. Yin Chao Mai imbalances. Symptoms and signs are aches, pains, weaknesses, or problems along the path of the vessel, especially problems with the neck and the eyes. There's dry throat, dry eyes, insomnia, constipation, urinary problems, uterine bleeding, irregular menstrual bleeding, tightness, weakness or atrophy in the muscles of the inner sides of the legs. The feet point inwards, uneven hips, or one leg is longer than the other. Cramps and spasms at night. Leg cramps, wiry pulse on both chi position, and the pulse vibrates from side to side. Acupuncture treatment would be kidney 6, lung 7, local, distal, and tender points along the course of the Yin Chao Mai. Yang Chao Mai imbalances. Symptoms and signs would be aches, pains, weaknesses, or problems along the path of the vessels, especially problems with the neck, lower back, hips, eyes, and head, insomnia or narcolepsy, cramps and spasms, hemilateral paralysis, facial paralysis, headache, dizziness, tension, weakness, or atrophy of the muscles of the outside of the legs, sciatic pain, where the pain is along both the back and the outer side of the leg. The feet point outwards, structural imbalances between the right and the left. Example, one leg is longer than the other, or one shoulder is higher than the other. There's red eyes, manic behavior. Pulse would be wiry on both Shun position, and the pulse can vibrate from side to side. Acupuncture treatment would be urinary bladder 62 and SI3, local, distal, and tender points along the course of the Yang Chao Mai. Thank you for your attention.
Diagnosis according to 4 levels we discussed damp heat. Dampness and heat can bind together and are difficult to separate. Invasions of damp heat often occur in the summer when the weather is rainy and in humid and hot climates. There is often an underlying spleen dampness. It is also mainly the functioning of the stomach and spleen that is disturbed when there are invasions of damp heat. The way that the symptoms manifest will be influenced by whether it is dampness or heat that is the predominant pathogen. There can be a fever that is most noticeable in the afternoon. This is explained by dampness being a yin form of pathogenic qi, and yin is on the increase afternoon. When the yin dampness contains pathogenic heat, the pathogenic heat will increase together with yin in the afternoon. The heat will often cause the person to sweat. This will temporarily relieve the fever, but the fever will soon return. The person will often find that the fever comes in waves. Dampness blocks the movement of qi, creating a sensation of heaviness. This will be most apparent in the limbs. The heat aspect will make the muscles feel sore and ache. The stomach and spleen qi mechanism will be blocked by the dampness. This can result in nausea and the loss of appetite. There will also be diarrhea that is odorous and sticky. The heat can cause a stinging or burning sensation in the rectum during and after bowel movements. Dampness can also block qi in the upper jaw, resulting in chest oppression. The heat-yang dynamic can ascend the yin dampness to the head. At the same time, dampness can itself block the ascent of clear yang to the head. This will result in a heavy headache and a difficulty in thinking clearly. The heat will cause the headache to be pounding or throbbing in nature. Damp heat will be seen in the complexion, which can be yellowish. The skin and the sweat can be oily. Restlessness and irritability will arise if the heat aspect agitates the shen. Etiology: exposure to exogenous pathogenic qi that has either invaded the qi level directly or penetrated down from the wei level. Symptoms and signs: fever that is reduced by sweating but soon rises again. Fever that is worse in the afternoon and comes in waves. Heavy and aching muscles, especially in the limbs. Nausea, poor appetite, loose, sticky, odorous stools. Chest oppression. Heavy and possibly pounding headache. Difficulty in thinking clearly, oily skin, yellowish complexion, restlessness or irritability, red tongue with yellow sticky coating, rapid and slippery pulse. Key symptoms are odorous diarrhea, fever, yellowish greasy tongue coating, rapid and slippery pulse. Treatment principle: drain damp heat. We can choose from DO 14, LI 11, stomach 25, stomach 44, spleen 9, spleen 6, and REN 12. Needle technique: draining. DO 14 and LI 11 drain qi level heat. Stomach 25 and stomach 44 drain damp heat from the intestines. Spleen 6 and spleen 9 drain damp heat. REN 12 drains dampness from the middle jaw. The person must avoid consuming foods that produce dampness or heat. Damp heat can be caused by wei level heat and can result in yin level heat, blood level heat, and spleen qi deficiency. Thank you for your attention.
Let us talk about the treatment principles of early treatment to prevent progression of illness. The sure basis for treatment is a firm diagnosis established by means of the 4 diagnostic methods: symptom analysis and differential diagnosis. Without a firm diagnosis, the optimal results from treatment is not possible. There is a passage in the Internal Classic that compares the treatment of an illness to the governance of a nation. The key to governance of a nation lies in effective laws and institutions, and these laws and institutions are more effective if put in place before the occurrence of any disturbance than after. Similarly, therapeutics should emphasize prevention prior to the development of an illness. This is not always possible, but prevention is still applicable when illness has begun. In this context, prevention includes 3 concepts. When illness has begun, prevent the complications. Secure unaffected regions to prevent progression or transmission of illness, and prevent complications during convalescence. Though the ideal is to prevent illness from developing at all, it is not possible for every person in every situation. However, it is of practical significance to maintain an optimistic outlook as well as to diagnose and treat early in order to prevent complications. Illnesses manifest traceable symptoms of development and progression. Making an early diagnosis requires the physician to observe the patient carefully and search thoroughly in order to formulate a firm diagnosis. For example, an exogenous illness generally proceeds from the exterior to the interior and from the superficial to the deep. Hence, when the illness is still in the exterior, the physician must seize upon the cold intolerance, fever, body aches, and other characteristic symptoms and promptly secure the exterior, so that the pathogenic evil can be dissipated from the exterior and prevented from going deeper. In case of wind invasion, before the appearance of sudden syncope, wry mouth, hemiplegia, and other typical symptoms, the physician must seize upon the early symptoms of dizziness, faintness, and numbness of the limbs, and in optimistic anticipation, apply the therapeutic principle of calming the liver and extinguishing wind. By applying this principle, the physician can often prevent the illness from progressing into the meridians and the viscera. In accordance with the theory of the five elements, because of the relationships of generation and restraint, illnesses in a visceral organ will often transmit to another visceral organ. For example, the liver belongs to the wood element and the spleen belongs to the earth element. When movement of liver qi is impeded in the spleen and the stomach can become injured. In the early stages of impedance of liver qi, in addition to removing the blockage, a skilled physician will often apply herbal medicines and strengthen the spleen and the stomach to prevent the injury or insufficiency, thereby closing off the path of transmission for the liver illness. In the treatment of heat illnesses, it is often feasible to complement sweet cold herbs that nourish yin with salty cold herbs that augment yin in order to prevent heat from further injuring kidney yin, even after it has already injured stomach yin. In the treatment of an exogenous illness, in order to prevent the illness from transmitting from the exterior to the interior, it is possible by applying acupuncture to the acupoints along the foot yangming meridian to facilitate the movement of qi and blood. Doing so may prevent the exogenous evil and tying from transmitting to the interior. These are examples of securing regions not yet affected by illness. During convalescence, genuine qi may not have recovered fully. Sometimes the treatment may not be sufficiently thorough in removing the pathogenic evils, allowing it to submerge in the body. If this is neglected or improperly managed, there may be recrudescence of the illness. The treatise on cold attack points out clearly that during the convalescence from an exogenous illness, the person must not overindulge in sexual activity in order to avoid the appearance of such symptoms as weakness, fever, dyspnea, nausea, or vomiting, which indicates re-injury of qi and blood. In general, after symptoms have subsided, the patient should continue to take medications for a period of time, depending on the vigor or weakness of the constitution and the amount of residual pathogenic evil. Sometimes, when first recovering from a heat illness, the patient may show subsidence of fever and coldness in the body. At this stage, there is often residual heat. Using a warming herbal formula or a restorative at this time may reactivate the residual heat, much like the rekindling of fire from the ashes. Thank you so much for your attention.
Let's discuss diagnosis according to Zhangfo organ patterns with the pattern damp cold invading the spleen. Damp cold invading the spleen can be both acute and chronic. If it is an acute pattern, it will be due to an invasion of exogenous pathogenic qi. It will, however, still be classified as an interior imbalance because the pathogenic qi is located in the interior. Etiology. Damp cold can invade the spleen when a person has been living or working in a cold and humid environment, has been wearing wet clothes, or has been consuming medicine, food, or beverages that are cold and damp in either their temperature or energy. Damp cold can also invade the body by the spleen channel in the feet and legs if the person has walked barefoot on cold and damp surfaces or has worn shoes that are not warm and dry enough. Coming into contact with certain bacteria and viruses can result in damp cold conditions. This can be anything from eating food that has gone off to cholera. This is because a pattern of imbalance is defined by its symptoms and signs. If the symptoms and signs are those that are seen in damp cold, then that which has caused the imbalance will by definition be damp cold in nature and will be treated accordingly. Symptoms and signs. There will be poor appetite, nausea, abdominal distension or sensation of fullness in the abdomen, loose stools or diarrhea, sticky taste in the mouth, lack of thirst, loose or reduction in the sense of taste, heaviness of the arms and legs, white sticky vaginal discharge, edema, cold sensation in abdomen, fatigue, heaviness in the body and head, brain fog, difficulty thinking clearly, or a sensation that the head is full of cotton wool, dull white complexion, a thick white and greasy tongue coating on a pale tongue in chronic patterns. That coating will not necessarily be as thick. Slippery and slow pulse. When there is an invasion of exogenous pathogenic qi, the pulse will be fuller. The key symptoms here are loose stools, no appetite, no thirst, a slippery pulse, and a white greasy tongue coating. Treatment principle: transform and drain dampness and cold. Acupuncture points, we can choose from stomach 8, spleen 6, spleen 9, ren 6, ren 8, ren 9, ren 11, and bladder 22. If there is also spleen chi deficiency, we can add spleen 3, stomach 36, ren 12, bladder 20, and bladder 21. For the needle technique, we tonify stomach 36, spleen 3, ren 12, bladder 20, and bladder 21. We use draining or even technique on stomach 8, spleen 6, spleen 9, and bladder 22. We use moxa on ren 6 and ren 8, and moxa can also be used on the other points. For the explanation on the choice of points, stomach 8 drains damp phlegm from the head, ren 9, spleen 6, spleen 9, and bladder 20 drains dampness, ren 6 and ren 8 with moxa can expel damp cold from the middle jaw. Ren 11 regulates qi and drains dampness from the middle jaw. Stomach 36, spleen 3, bladder 20, and bladder 21 tonifies spleen qi, transform dampness, and regulate qi in the middle jaw. A person with damp cold invading the spleen should avoid food and beverages that are cold both energetically and in their temperature. They should also avoid consuming anything that produces dampness. This means that their products, cold drinks, ice cream, sweets, cake, dried fruit, sweet, sugar, lettuce, cucumber, tomato, melon, and tropical fruit should be avoided. They will benefit from consuming foods that are cooked, baked, and roasted and have a warming energy. Ginger will be particularly good as it is warming but also spicy and thereby expels exogenous pathogenic qi. Keeping the abdomen warm and dry is also vital in this pattern of imbalance. Damp cold invading the spleen can be caused by spleen qi deficiency and spleen yang deficiency. In turn, it can result to spleen yang deficiency, phlegm dampness, and damp heat. So to recap, the cold damp invading the spleen can be due to exposure to exterior dampness from either weather or living conditions with spleen qi deficiency underlying, allowing damp to invade. Signs and symptoms: poor appetite and digestion, fullness and oppression in the stomach duct and epigastrium, which is better for warmth, heaviness in the head and limbs, sweet or sticky taste or absence of taste, no thirst or thirst for warm drinks, loose stools, leukorrhea, tiredness, dull white complexion, and the pulse is slippery and slow. The tongue is swollen, pale, with sticky white coating. Treatment principle: warm the center, dispel cold, and disinhibit damp. Acupuncture treatment: we use spleen 9 to drain damp in the lower burner, ren 12 to supplement the spleen and disinhibit damp, spleen 8, stomach 8 to transform damp in the head, bladder 20 to supplement the spleen and resolve dampness, ren 11 to harmonize the middle burner, spleen 6 to disinhibit dampness, spleen 3 to supplement spleen qi, bladder 20 to harmonize spleen and stomach, Ren 9 to harmonize the intestines, and stomach 22 to regulate the intestines. We needle with supplementation and large amounts of moxa. Thank you for your attention.
Diagnosis according to Gini imbalances. Accumulation of fluids. If there is a disturbance of the lung, spleen, or kidneys functions with respect to the transformation and especially the transportation of fluids, these will stagnate and accumulate in the body. This will correspond to a condition of edema in Western medicine. Accumulation of fluids can also occur when there is qi stagnation. This will be because qi does not move the fluids, which will cause them to stagnate, creating dampness and phlegm, which in themselves can block the movement of fluids. If the condition is due to a disorder of the lung, there will most often be edema in the face and the upper part of the body. This condition is often acute and will usually be due to an invasion of exogenous qi. Spleen yang shu can result in edema accumulating in the middle of the body and in the limbs. Kidney yang shu can manifest with edema that both kidney yang shu and spleen yang shu edema will be chronic conditions. One way to distinguish whether the edema is due to a shu condition of the lung, spleen, or kidney, and edema that is due to qi stagnation or damp is by pressing a finger down into the area where there is edema. If the edema has arisen because of a kidney, spleen, or lung shu imbalance, an imprint of the finger will remain after the pressure is released. Etiology. This condition arises when there is a disturbance in the transportation and transformation of fluids in the body. Acute edema is usually seen when the lungs' function of spreading fluids is disrupted by the exogenous qi. More chronic conditions of edema usually arise from spleen and or kidney yang shu, qi stagnation, or phlegm dampness condition. For a description of the etiology of these patterns, please see the relevant parts of section 6 and 8, where these patterns are discussed. Symptoms and signs. Edema. The tongue will be swollen and wet. The pulse will be slippery. Key symptoms, edema. The treatment principle would be to drain the fluids. The acupuncture points we choose from Ren 9, spleen 6, spleen 9, and urinary bladder 22. If there's invasion of exogenous qi in the lung, add gallbladder 20, lung 7, Li4, and Li6. If there's spleen yang shu, add spleen 3 and stomach 36. If there's kidney yang shu, add kidney 7 and do 4. If there is qi stagnation, add liver 3 and Li4. If there's phlegm and damp stagnation, add stomach 40. Needling technique would be to drain Ren 9, spleen 6, spleen 9, lung 9, Li4, GB20, and upper urinary bladder 22. Tonify the remaining points. Moxa is recommended on spleen 3, stomach 36, kidney 7, and do 4. Explanation is Ren 9, spleen 6, spleen 9, and urinary bladder 22 drain fluids and dampness. GB20, lung 7, Li4, and Li6 expel exogenous qi, and regulate the water passages. Spleen 3 and stomach 36 tonify spleen yang. Kidney 7 and do 4 tonify kidney yang. Liver 3 and Li4 disperse stagnant qi. Stomach 40 transforms phlegm. The relevant advice would be, this will depend on the underlying pattern of your imbalance. Please see the appropriate sections for advice. The accumulation of fluids can be caused by the following patterns of imbalances. Invasion of qi, lung qi shu, spleen yang shu, kidney yang shu, qi stagnation, dampness. Accumulation of fluid can also result in the following patterns of imbalances. Spleen yang shu, kidney yang shu, dampness, phlegm. Thank you for your attention.
Let's discuss diarrhea. The following patterns: retention of cold, dampness, retention of damp heat. Retention of cold dampness, clinical manifestations. Diarrhea, which in severe cases may be like water, abdominal pain, barbarigmi, a feeling of oppression of the chest, no appetite, fever, which is not always present, aversion to cold, nasal obstruction, headache, feeling of heaviness, tongue, thick, sticky, white coating, pulse, slippery, slow. This may be an external pattern when it is caused by exterior dampness. The pattern may then become internal when dampness is retained for a long time. Treatment principles: scatter cold, fragrantly resolve dampness. Points: REN 12, bladder 22, spleen 9, spleen 6, REN 6, with moxa on ginger, stomach 25. Reducing or even method, except on REN 12, which should be reinforced. REN 12 tonifies the spleen to resolve dampness. Bladder 22, spleen 9, and spleen 6 resolve dampness in the lower burner. REN 6 with moxa on ginger expels cold from the intestines. Stomach 25 stops diarrhea. Retention of damp heat, clinical manifestations: foul smelling, yellowish loose stools, abdominal pain, increased frequency of bowel movement, feeling of fullness and heaviness of the abdomen, burning sensation in the anus, feeling of heat, thirst, scanty dark urine. Tongue, thick, sticky yellow coating, pulse, slippery, rapid. This may be an external pattern when it is caused by exterior dampness. The pattern may then become internal when dampness is retained for a long time. Treatment principle: clear heat and resolve dampness. Points: REN 12, bladder 22, spleen 9, spleen 6, stomach 25, bladder 25, LI 11, stomach 37, stomach 39. Reducing or even method: no moxa. Most of these points have already been explained earlier for the cold dampness type. From the acupuncture perspective, the treatment of cold dampness and damp heat differs only in the use of moxa. LI 11 resolves damp heat and stops diarrhea from heat. As a C point, it treats the young organs and specifically diarrhea. Stomach 37 treats chronic diarrhea, and stomach 39 treats lower abdominal pain. Thank you for your attention.